All right, a very good morning to all the participants. Welcome to our very first module for the 24th Medical and Health Research Week. I'm your moderator for today. I'm Dr. Tan Jenkit from Biochemistry Department. So we have a very honor to have today we have three very distinguished and very experienced, especially our first speaker. So without further ado, I would like to introduce the first speaker. Allow me to share the screen on her background. Okay. All right. Our first speaker, very distinguished and very experienced, Emeritus Professor Dato Wan Zurinah Wanga. Emeritus Professor Dato Wan was awarded as a Professor Emeritus by UKM in 2017. While in service at the Faculty of Medicine, she held various administrative posts, including Deputy Deans of Academic Affairs, Head of Department of Biochemistry, Deputy Director of Research at UKM Molecular Biology Institute, UMBI. She was the first woman in the UKM to represent the Senate as a member of UKM Board of Director, our LPU. She was the panel members for evaluations of many grants in the Ministry of Education. For example, all the GS, the FLGS, the LGS, LRGS, MOSTI, and Academy of Science as well. So she's a trainer in developing research proposal to UKM, various universities, for example, UITM, USIM, UNIMAP, and USM as well. So she was the editor for journals such as Scientific Reports, was the founding editors for Malaysian Journals of Biochemistry and Molecular Biology in 1990. Her research interests include oxidative stress, inflammation-associated degenerative diseases, and aging, including modulators such as the palm vitamin E tocotrienols, and has published more than 150 papers internationally. So currently she's working as a special contract professor at Shiga University of Medical Sciences in Japan. So I guess she's still in Malaysia. She's now on vacation on Malaysia now. So we are very honored to have Datuk Wan. So Datuk Wan, the screen and the mic is yours now.
Thank you very much, Dr. Tan Jenkit, for the very kind introduction. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And good morning, everybody. Yeah, 123 participants. I hope you have seen my chat in the thing. If there's anybody who would like to share their proposal to get some comments, I'm happy. We're happy to sort of be together and share the comments. Yeah. Thank you for the invitation to speak to Associate Professor Dr. Wan Zurinah and also committee members. I'm currently in Malaysia on official business as well as on holiday for the summer. And if you can allow me to share my screen. Can you see my screen?
Yes, bro.
Yeah, okay. Yeah. So I'm supposed to talk about developing and submitting a research proposal. As you can, I gathered that most of you are actually postgraduate students, but I have sort of added a little bit of points about applying for grants as well. In case some of you went on to become lecturers and also to do research, say in KKM, say you join NIH or or other institutions that require research. So actually, purpose of research proposals, there are two purposes for research proposals for grant application. And this is actually when you join as a lecturer, academic, for instance, any of the universities, it's a lecturer's job to get grants, yeah, because you're supposed to do research. It's part and parcel, even if you're in the clinical discipline. It's also if you're a researcher in a research institute, and also a scope of your job, yeah. and it's essential for progression. Here I say progression, sometimes people just assume that it is promotion. Yeah? When I say progression, it includes, it's actually mainly your progression as a researcher. As a researcher, you have to have grants, you have to be able to obtain grants if you are going to progress and develop as a researcher. And then, of course, the promotion will come with it. So progression is not just limited to just promotion, yeah, because nowadays people just assume everything is in terms of dollars and cents. Yeah? So it builds expertise, and then it builds strength of the faculty or the institute. And even if you are in the Ministry of Health, for instance, yeah, doing research will do things for the not just for the university, you just if you're a postgraduate student in university, but also for the country, for humankind, for mankind. Yeah, you are reducing the pain and suffering of your patients through research. You're improving the service. Yeah. So the second purpose of research proposals are actually thesis, or for your thesis or for your dissertation, for postgraduate. So the size of the thesis or dissertation are different according to what is the requirement. Yeah. So if you're required to do a big thesis, for instance, you are a master's or PhD by research student, then your thesis will be a lot bigger in terms of scope and breadth and depth. Whereas if you're doing clinical masters, then your research component will be a smaller part because it's just one of the requirements for to graduate. So what determines the quality of the research proposal? It's actually two parts. Yeah, the research proposal, the two most important parts, yeah? And one won't be good without the other. The first part, yeah, is actually the science of it. Yeah, the content to be researched. And this is really important because when you want to do research, you spend a lot of time, a lot of energy, and a lot of effort as well as resources, that goes into the research. So the science has to be good. It's something worth investigating, something worth researching. Yeah, that is the science of it. We call it a scientific merit, the scientific merit of the research. It can be clinical, it can be a clinical study, but it has to have scientific merit, and not just something that you want to do because it is, you have to get it up of the way, you have to get it done, and that's all. And the second thing is how the proposal is written. The proposal has to be good. Yeah, so the research proposal has to be clear, has to be concise, has to be convincing, has to be complete. So one without the other, then you won't get a good research proposal. So for instance, your research problem is clear. What is it that you want to address? Research questions are clear. If there is poor scientific merit, but your proposal is good, then it's not going to work out as well. But if you have a good scientific merit, your question that you are going to ask is actually something very serious that is affecting your patients, for instance. But your proposal that you wrote is not clear. So it's still the same thing, you won't be able to convince your supervisor, for instance, or the wherever, or even the ethics committee, because it is not clear. Yeah. So there's two parts. I repeat, the science of it, the scientific merit, as well as the way the proposal is written. Okay, so both has to be good. So top-notch research proposals require taking ownership. If you're a student, yeah, you cannot just say, "Oh, this is what you have done," and you leave it the rest to your supervisor. If you're a postgraduate student, you have to take ownership. It's your research proposal. It is your research. It's what you're going to be doing. You cannot just do it as a requirement. Yeah. So this requires quite a bit of discussions with the supervisor, discussions with mentors or with peers. But don't worry if you are not good the first time, because this one actually improves with practice. But although I say that it improves with practice, there are actually ways to facilitate how you get better at writing proposals. So from the idea, you can develop research objectives, yeah, from the scientific merit. And then sometimes you have to apply for funding. Sometimes it could be from the faculty, you require a small funding, or you need to get ethics approval. Usually any study, whether with humans or with animals, you require ethics approval. And then you develop the proposal, and then you submit to your supervisor, or if you're a lecturer, or you submit to your mentor. And the good thing is that you keep trying, keep improving. It's okay to not get it right the first time round. That is the message. So if you're applying for grants, for instance, sometimes for master's or PhD by research, you're asked by supervisor to ask for funding from grants from KPT. So the grants that are available are the FRGS, Fundamental Research Grant Scheme, or Transdisciplinary Grant Scheme, Research Grant Scheme, or the long-term research grant scheme. All these are all fundamental research. Fundamental research meaning, that means it answers the question of how and why. That is the meaning of fundamental. But when people think about fundamental, just to clarify the air, fundamental does not mean lab-based. Fundamental answers any questions of how and why, and does not only refer to lab-based. So some lecturers are confused when they think that it is fundamental research. They think it is only lab-based and only applies to preclinical, but not true. This one applies to clinical as well. The only thing is, what are you trying to answer? Why and how? So step one, to find the idea for the scientific content. If you're a student, postgraduate student usually, sometimes the question is already given to you. The topic is already given to you by your supervisors, by your lecturers. But you can still make it your own, because your supervisor is not going to give you everything. They just give you some idea, and then you have to develop the proposal. And the important thing here is note, when you're talking about doing a research proposal, the word they use is actually developing a research proposal, not writing a research proposal, is developing, because it requires a few steps. So the idea, the observation, maybe observation during practice, why you see certain patients, for instance, presenting with certain symptoms, or how they respond to certain drugs or certain treatments, or how they do not respond. So these are the questions that possibly that you can ask. So looking at your patients during practice, if you are seeing patients, and it could be your interest, what is your interest? And you see certain things. I'll give you an example afterwards. Topic, it's a current research, it's pressing, it's high incidence. Practicality, usefulness, the research problem, and then you develop the research question, okay? Develop the research question and develop the proposal. Note, both are all developing, not just writing. So getting started for students, I mentioned topic is usually given, but can still make your own. Take ownership. This is really important, taking ownership, because if you would want to do something for yourself, then you want to do it, you want to do a good job of it. Not something that just needs to be that needs to be done and get over with. It's something because you want to go back to clinical. It's not something that you are interested in. It should be because this is part and parcel of your clinical practice, making things better. And you want to do things better through research, because then it is evidence, it's not anecdotal, okay? So research questions, important, worth answering. Otherwise, it is wasteful. Waste, human resource, time, money is a waste of resources, And it's also unethical and not according to what we call good research practices. Yes, it's not just good clinical practice, there's also good research practices, So I'll give you an example. We had a meeting some years ago with the cardiothoracic surgeons, the researchers from UMBI at the time. We were with UMBI, and we had a meeting, and then the surgeons were telling us that they see two types of patients in OT. One group are younger, less than 45, and the other are older, more than 60 years. So they say, why is that so? And now there's a question. Excuse me. So there's a question now, why there are two types of patients that they see when they open up the patients in OT, okay? So that sort of created an interest, and then we went on to study, you see, is it a genetics that is predisposing the earlier patients to develop CAD earlier? When we checked, apparently there are two groups. The one is called premature coronary artery disease, PCAD, and another one is called coronary artery disease. Yeah? So above 60 years old are the ordinary coronary artery disease. So is it genetics that is predisposing the younger patients to CAD? Or is it something else, So then can you sort of diagnose, them earlier, identify them so that measures can be taken for intervention? So, and we also read that they say the plaque that they see, the plaque types are different. One is yellowish and the other one is white. So what is the composition? If there's a composition that's different, that means the pathogenesis might be different. The development, the deposition of the plaque could be different. Are there lifestyle that actually determines the onset of the disease? Are there biomarkers? So all these questions are raised just by having these sort of discussions between the cardiothoracic surgeons and researchers. And it raises questions that possibly can be researched. And I can tell you after this, we actually managed to get one PhD student, 2 master students to work on it, and also an SSM, the special study module for undergraduate. And actually the research is actually published from this discussion. Yeah. So you see, the idea is actually saying what the cardiothoracic surgeons see these questions and require further and providing ideas for investigation and developing proposals. All that resulted in developing proposals. Yeah. Okay. So some tips to get cutting edge ideas. Yeah. So no choice. You have to read conferences if you have the chance. Yeah. If you cannot nowadays, conferences, if you need money previously to attend conferences because you have to go and you have to travel. But now with post-COVID, there are conferences, a lot of conferences are actually hybrid. So you can actually attend conferences online. Yeah. So that is a good way of getting to know what is the most recent findings that people are getting, the knowledge that is very current that hasn't gone into publications yet. Yeah. Because usually at conferences, people present the latest that they got. Yeah? Sometimes we hear when we attend conferences, they say this came out of the lab 2 weeks ago, just last week. So it's really, really current. It's not yet published. Yeah? So that is a way of getting what is the most recent so that you're not going to study or develop a proposal that is, looking at something that people are no longer looking at, that is sort of might not be so relevant. Yeah. So reading is one. Yes, you have to read quite a bit. Yeah, nature, science, attend conferences, check discoveries. If yours is more of the applied in terms of research that you want to look at, say medical devices, for instance. So check discoveries, check strategic plans for NIH, for instance, attend niche conferences, and check technological advances. Yeah. So these are some ideas. I know it sounds like a lot, and you're busy. You're really, really busy, but you don't have to spend a lot of time actually looking. You just have to develop the skill to quickly go through, these things so that you get some idea. You will have time. I'm sure you will. You just have to spend, say, about less than 1 hour a day. When you're feeling tired, you just scan through your phone and look what is the latest. Instead of checking the social media or checking your TikTok or so when you're a student, I think that has to be put aside for the moment. Yeah. So that is how you get some cutting edge ideas. Yeah? So according to NIH research proposal, the content, I'm talking about scientific merit here, content must be important and critical, must be novel, there's large room for new technology, and also some expertise and preliminary data. And this could come either from the lab or from the department or from your supervisor. Yeah, they have already done some work before, and you're just continuing with the work. Yeah, so note the important and critical. Yeah, terms of them. So I thought grant application here. I said grant, but it's also a proposal. Yeah, if you're doing masters. Yeah, hypothesis should be innovative and will significantly advance the knowledge of the field. So in biomedical research, to increase understanding of biological processes, diseases, or treatment and prevention. Now, when people talk about biological processes, people think it's just, it's just only in the lab. It's not going to have any use. But always, from understanding biological processes, then you can identify, not only understand how the disease develops, but actually you can identify targetable sites for therapy, for management, for treatment, yeah, and for diagnosis. So this goes without saying, and sometimes we are a little bit limited in our thinking in terms of what will be the applications of of doing something that will lead to understanding of the disease. So to improve the quality of the process of the proposal, there are processes in place. Supervisors or mentors are in place. Mentors, usually if you are a lecturer or you are a staff, the proposal, when you develop proposal, don't forget to write the flow chart. The flow chart actually gives a presents very summarize your experimental design. Flow chart is not a flow chart of activities, like do literature review, write proposal, buy chemicals. It's not that. Your flow chart is actually your experimental design. How many arms, what type of patients are you taking? What are the exclusion criteria? What are the parameters that you are measuring? This should be in the flow chart. So processes to improve the proposals. I tell you, even if you are a very seasoned and experienced, researcher, you can still, one can still improve in terms of writing the proposal. Yeah, that comes from experience. I tell you, even now, when I write proposals, I still would value in terms of discussions with other people. Yeah, we always discuss all the time. We want to do this one, this is what we want to develop. So don't think that getting opinions from either from people, from peers, mentors are only for postgraduate students. It's for everybody, for any serious researcher or any researcher just starting, not even serious. If you're just starting, you benefit from getting feedback. So what this means is that developing a research proposal the quality will improve when you have discussions, and discussions with people, with various people, not just your supervisors. So then you can actually, write down things that are not clear, write down objectives that are not there, get some ideas from other people as well, not limited to just you writing it. Yeah. So, and you have to look at the infrastructure of what is required to actually conduct your experiment. So here, prepare a fantastic research proposal. That was a summary just now. So it's the 4 C's, that's clarity, concise, convincing, and complete. And this is the generic research proposal. I'm sure you are aware of this, the title, the abstract, the executive summary. The executive summary should have everything, the question, the objective, the method, and then what you expect to get in terms of findings. Yeah. So this executive summary is actually a summary of your research proposal. Yeah. So it's not something different. So you have to identify what are your research problems. Okay, research questions and hypotheses. Research problem is the big problem. It's a big problem that you are addressing. For instance, say you want to find out why there is a neurodegeneration with cognitive decline, say with aging. Yeah, you want to find out why cognitive decline. Yes, it is part and parcel of aging, but how fast does it go? For some people, it's not so fast, but for some, it is faster. The rate varies. So your research problem is actually neurodegeneration, and then you develop some research questions on it. You want to look at which time point, for some people, they will decline very fast. So that could be a research question. And you develop the hypothesis from the research questions. Yeah. So there are general objective. General objective is your big overriding objective, and your specific objectives are measurable. SMART. SMART. They are specific, measurable, and their time ART. ART. You can check later on and see what the SMART when you develop the proposal. So there is background, introduction, research methodology with flowchart and budget. Of course, you must include ethics approval and all that. Yeah, timeline, Gantt chart, milestones, and all references. Yeah, it doesn't have to be complete at your level, but I know some departments develop the research proposal like it is. It was already fairly complete. There are some practices like that, that the proposal is almost like a full thesis already. But it depends, yeah? It depends on what is required. So title, Title should reflect the content, should be straightforward, uncomplicated, easily read and understood. And consider a title that is as short as possible. You omit words like effect of, a study of, investigation of, you omit words like that, straight to the point, and make the title sort of catchy. Sometimes it's boring when you say, oh, a study of, particular disease, say in hospital ACTM or something like that. So it is very it's not catchy, and it is sometimes not so clear. Make sure your title includes the focus of the study, and I already mentioned, eliminate words, unnecessary words, approach to, and also sometimes the place of study. Because sometimes the place of study it sort of limits your study, although your sampling is from that place. Okay, I mentioned about executive summary. Okay, that is in terms of if you're applying for a grant, fundamental or long-term grant scheme or product-oriented. So whatever it is, executive summary should be clear and should be complete. Contains all the necessary information. And put here background in terms of the aims, the methods, the expected outcomes, and the applications. So these are the 5 components of the executive summary. So research background, never assume that reviewers know what you mean. Refer to literature thoroughly and present a clear rationale for the proposed work. I know your next lecture is actually how to do a literature review. I know many of us, because we are sort of short, not enough time to do. With you, if you are in a clinical masters, then you have to do clinical work as well, and that sort of limits your time. But actually, you just have to read around the subject, and a good way is to start with the reviews first, and then go to the reviews are called secondary sources, but you have to go to the primary sources, which are the original articles later on. So the reviews is to get an overview first, and then you go to the primary resources, primary references. Because when you are a postgraduate student, you cannot just refer to secondary sources, such as reviews. Okay, so background proposal involved doing a review of literature. There's a difference here between I put here between application for a grant as well as from in your thesis. If it is a proposal for a thesis. So if it is for a grant, they're shorter, more to the point, usually without headings and subheadings, and limited number of references for the background. And this is for application of grants. Grants. But if it is a chapter in your dissertation, that it has to be longer. This is the background, the introduction. So it has to be longer. And subheadings, there are subheadings and there are subheadings. So there are 2 different things here. Background. And sometimes the background for grants is the same as the introduction. The background is the same as the introduction. But for thesis, there are some thesis formats that require the background to be different from the literature review. So whatever it is, you have to follow the format of your thesis. If you're mainly from UKM, I think in terms of the chapter, there's one first, the background, and then for background or introduction followed by the literature review. There's 2 things here. So be alert to the format that is required in terms of when writing the background or the literature review, and even in your proposal, the proposal point. So be alert to that. So explain the science clearly for the background. Do not assume you will know everything, but omit basic textbook information in introduction. Just omit them. You can mention in a line or 2 lines, but after that you zoom in straight away into your work. No need to elaborate on what is happening all over the world when what you're focusing is actually something very specific that is occurring in Malaysia, for instance. Choose references carefully and critically. This will probably come in greater detail during your next lecture, but I wanted to just mention, when I say carefully and critically, that means the most recent 5 years, or most is 10 years, unless it is a landmark paper. If it is a landmark paper, then you can go further than more than 10 years. Critical meaning you don't have to put in, say, 200 references in your proposal. when you're writing a proposal, it has to be very to the point. And this is just a proposal that you're developing. Yeah. So I would limit to about 25 references for a proposal. Yeah. For a proposal first. Yeah. So 20 or 25, I say. For grants, limit to 20, even less. Okay. Justify because of significance. Yeah? Because of significance and the scientific importance of it. And not because it is your interest and less well studied or paucity of data. This is very important, yeah, because sometimes I got, oh, this is because it is of your interest. No, you have to find, you have to say this is, either controversial, there is a gap there. The people are still, it's contentious, people are getting different findings. So you have to identify the gap, yeah, the gap in you have to mention it already in your background, because that is what you're building to your research proposal. So this is how it should be, the funnel of unit. What to include, the burden, how common is the disease, statistics, for example. When you say statistics, when there are figures, there must be references. Yeah? Any number that you quote must have the figures, yeah, other references. So severity of the disease, it's very common. Say if you want to work on, say, colorectal cancer, yeah, say RC. So it is the most common cancer among men in Malaysia, and second among women. So that is something that you have to emphasize. So that it is an important problem. Huh? What has been done, what is known, what is not clear, and this is the gap, and connect to the parameters that you're going to measure. So whatever parameters that you're looking at, you have to introduce, in your background. You have to introduce, okay? So background, you have to establish, excuse me, framework of research, the issue of the research problem, yeah, studies that have addressed deficiencies, gaps I mentioned, contradictions, controversies in the reported studies, importance, benefits of the study, and the purpose statement. Yeah, so you end your background with the purpose statement. Okay. So this is a checklist, straight to subject matter, why it's important to study. Current knowledge of subject with the gaps, 1 or 2 pages. This is a research proposal that you are developing. About 10 to 15, even less. This time I mentioned about 20, less than 20 or 25. Current references, prelim findings, if there are already things done, yeah, by your supervisor, in the lab or in the department that you're working at, and with a research question, but avoid having any sweeping statements. Yeah, no sweeping statements. Okay, so usually there is a link between the research problem, yeah, what is your research problem, the hypothesis, and from the hypothesis you develop research questions. That's how you go about in terms of when you're developing a proposal. What is the research problem that you are addressing? What is the hypothesis? What is the research question that you want to develop from there? Say, okay, research problem you mentioned just now is colorectal cancer, for instance. I'll give you an example, okay? And then you say, okay, so it could be something, it could be, is it contamination? One of the contamination from our diet, for instance. Say it includes, say, microplastics, for instance. We using plastics everywhere. It's getting into our food. It's getting into everywhere. So then you develop a hypothesis. Microplastics, is microplastic a contributor to the development of CRC? Then you develop your research questions. Okay. So these are some examples, like just now when I mentioned about coronary artery disease. So why is it happening in younger patients, less than 45, and also in another group of patients, above 60? So this is what is the problem, So then you develop the hypothesis. Your one single hypothesis could be, is it genetics? Then you want to study the genetics of it. And then you develop your research questions. Okay. So research problem is one paragraph, yeah? And usually the research problem is your own. It's a story that you make. Yeah, the research problem is your own. So there's no references, and the size of the problem, the importance of the problem, the significance of the problem, you have to write in your research problem. Okay, so it is usually one paragraph and not a fairly short paragraph. That is a main research problem that you are addressing in your research proposal, because you cannot address everything there is, about the subject matter. Okay, hypothesis to be tested, stated as one statement, just one statement. Usually we don't write a null hypothesis, yeah, you just put as hypothesis. And flow from research will be translated into general objective. So the hypothesis will be translated into your general objective. If it is a drug trial, you want to show superiority or equivalent or new application if test. And then if it is a test, you always must include a gold standard. Okay. So research questions, usually there are 4 or 5 research questions. Note, research questions will be translated into your specific objectives. Okay. So research questions that you pose, yeah, will be translated into your research objectives. Yeah. Sequence will follow sequence of research objectives. So you pose the questions, but these questions will be answered by your research objectives. And usually there are about 4 to 5 questions. Yeah. So depending on the scope of your on type of study that you're doing. So if you're clinical masters, it's probably 3 to 4. But if you're a PhD, then it's more than that, 5 or 6, or 7, depending on how, in terms of the research questions, more questions to answer. So general objectives is related to hypotheses being tested, what the project hopes to achieve. And specific objectives are measurable parameters, yeah, smart, appropriate with time, budget, ceiling, and scope, yeah. And when you put the objectives, yeah, you follow the sequence of the experiments, the chronology of the research. Yeah? You must arrange it chronologically because then it shows the, what steps are being taken to do the research, to answer your research question. You are proposing, this is proposing, but doesn't mean that you will know, but this is what you are proposing, that you want to do this first, optimize something first, and then you want to do this, develop something, you want to do intervention. So it has to be, objective has to be in sequence, right? Otherwise, it doesn't make sense, yeah? So methodology must have ethics approval, must have type of samples or sampling location, sample size, inclusion, exclusion criteria, design, treatments, interventions, methods or parameters to measure, method of analysis, flowchart. Sometimes you don't have to write the methodology, especially for detailed methods in detail. You just give the outline and also the reference if it is according to what has already been done before. Okay. So approach the characteristics, you have to clear approach to answer the hypothesis. Yeah, when we check a proposal, we want to make sure that your approach actually answers the question, will be able to answer the question. Because sometimes you pose a hypothesis, you pose a problem, but your approach will not be able to answer the question. And so that is a problem, right? And usually you will get guidance from, of course, your supervisors and your, mentors and that. So your design must be clear. Sequence should follow objectives. This is your methodology. Yeah? A brief but thorough with sufficient details and using latest or current platforms. Yeah? So include the flowchart or design of the research. I mentioned already, a flowchart is not a list of activity. So like say, do literature review, apply for ethics approval. No, flowchart is actually, I repeat, is your experimental design. How many arms, what are the intervention, what are the parameters that you're measuring, things like that, and what are the time frame, what are the duration of your study. So this is a methodology in a summary, study design, parameters measured, your data analysis, and the chronology. Yeah? So must be clear, appropriate, sample size must be, you have to be able to calculate, and just sufficient to understand and for evaluation. So evaluation, because you want to apply for ethics approval, proposal, you will submit to ethics or even to get some money from the faculty of the university. Okay. So sampling methods, these are methodological issues, power calculations, compliances, data acquisition management, participant training, and data analysis. Okay. So methods, okay. Golden rule is supply sufficient details, understood and evaluated, what will be done, how it will be done, how data will be collected, how results will be statistically analyzed, and these are, you can write your methodology as subheadings. Just not everything is all lumped together, but in proper paragraphs with subheadings. So human subject issues, I'm sure you are aware of this. Risk, protection, vulnerable groups, benefits to subjects and others, data safety monitoring, how you have to probably anonymize your patients, if you're doing clinical trials, for example. Inclusions, vulnerable, minorities, women, children, all that. So all this will have to be taken into consideration. I'm sure you will get guidance from there. Yeah. I mentioned already recruitment, informed consent, vulnerable population, incentives, okay, and participation. So sometimes they say the incentives too is actually an inducement or coercement. You coerce your patients, not necessarily, because sometimes you have to convince the ethics committee that there is no, you are not forcing anybody to join. It is free will. Okay, significance of study, expected outcome, output, state outcome, and potential application. Mentioned here, I mentioned this is related to how you write the proposal. If you write, you have a good idea, really good idea, but proposal is not clear, then it's also a problem, yeah, because it is disguised, yeah, because your idea is actually disguised, so it doesn't come across. If you're applying for funding, then you have to make sure that you comply to the funding criteria. If there is a maximum, then you keep to the maximum. Don't go over. It's a reasonable amount to conduct research and with sufficient details to aid evaluation and to get approval. Yeah. And if there are expensive items that you are buying, then you have to justify you need it. You really need it, otherwise the project cannot be done. So review proposal with peer or mentor and amend, submit. Submit here could be, if it is a grant, submit to the grant, or if it is to submit to the supervisor for discussion, for improvement. Okay. So in summary, 941. I think you can see that the scientific merit here is what is important. Two parts, yeah, I remember. Scientific merit and the way the proposal is written as well, quality of the proposal. That determines how good the proposal is. And then the format of the proposal, you have to follow the format, yeah? And the contents must be complete and has to be, and make sense, yeah? And convincing. So the other thing, of course, is left to submit is to make dua and to keep improving. And I wish you all success in terms of writing your proposal. I think that's all. I planned to finish a bit earlier because I thought I wanted to sort of have some discussion. Want to keep it as formal. I know there are about 149 participants. One has left. So okay, thank you, Dr. Tan. Thank you.
Yeah, thank you very much, Dr. Wan, for the very informative sharing. So if I can summarize, about basically it's about the 4 C's. Yeah? Your proposal have to be clear, concise, comprehensive, and compelling. You have to persuade your evaluators like the grant holders, your supervisory committees, or the maybe the departmental examiners. Yeah. So, and lastly, I share very deeply with Prof. Wan thought on the student have to take the ownership of the proposal. Supervisor may just throw the idea, but you have to take the ownership so that you can make the proposal more complete and clear. So since we have some time left, I think Prof. Wan would like to have some discussion, yeah, interactive sessions with the participants. Any participants you would like to share your maybe you don't have the complete proposal yet, but if you like to share, because Prof. Wan is not seldom with us, you mean how to say one-to-one session coaching. So this is a very precious moment. So grab the opportunities. Anyone would like to share your semi-cooked or uncooked proposal? So you are most welcome.
Even if you don't have a proposal, maybe something, some idea that you are sort of, that you are sort of going over in your head, maybe we can discuss here, how I wanted to illustrate in terms of what is a research problem, what are research questions, and how that is translated into a hypothesis, and how that's translated into general objectives. So
yeah, Prof, we have a very very brave volunteer.
Okay.
Dr. Ivana. Yes. Would you like to? Can you talk, or would you like to share your proposal? Ivana, how would you like to?
I don't know whether Ivana can share screen. She has to be allowed to share screen ataupun macam mana?
Yeah, or you can type while I. Yeah, because this is a
Very good.
webinar session. Let me get some help. By the meantime, maybe you can type the title, then we usually can tell roughly from there. Yeah.
Ada 3 participants raise hand. Ada Mabel Heath raise hand.
Yes.
Maybe while that one is being done. Mabel,
Okay.
would you like to speak, Mabel?
Just give me a few seconds. I will get the help from technical. Yeah.
Ivana can, if you had a share screen on your name, you can. Yeah. Hi, you. Hi. Hi, Mabel. You want to type in your thing because if you can't speak, Mabel can speak. Yeah, Mabel, you want to speak? You can't speak, Mabel, kan? Tak boleh cakap. Okay.
I can, Prof.
Hi, good.
I want to ask if, let's say, I want to do like some questionnaire stuff, right?
Right. Okay. Questionnaire.
How do I, if say I cannot find any validated already validated questionnaires on the I mean on Google,
right?
How do I get my questionnaires validated? Or how do I come up with
Okay.
validated questionnaire?
Right. Okay. I'm not quite sure what the study will be about, but sometimes if there isn't any available questionnaire that is validated, you can actually develop your own questionnaire first, something like, you develop your own and then you do it pre-test. You do pre-test with about, a few respondents first. You do, say, with 10 respondents, and then with the 10 respondents, you analyze, you get feedback, and then you improve on your questionnaire, and that will be a form of validation.
Oh, I see. That means I don't have to like go through any specific board or whatever.
No. If it you still have to go through ethics committee and all that with a proposal.
Okay.
So they will look at your questionnaire. You have to develop a proposal, and then you have to attach your questionnaire in your proposal. And the ethics committee will look at your questionnaire to see, whether your questionnaire is okay and all of that. And then once they approve, so you can do a pre-test first. You can do a pre-test, and then with a limited, maybe, sometimes they do it up to about, very 15 or something like that.
I see.
And then you analyze, and then you adjust accordingly. And then, of course, it has your what do you call? The process requires approval by ethics committee.
Okay.
The ethics committee will look at your questions and questionnaire because it's a new one. So there might be some sensitive material that you're asking,
Okay.
Then, but if ethics approve accordingly, they are assured of their, the patient's safety and concerns, then you can go ahead.
Okay. All right. Thank you so much, Prof.
All right. Welcome, Ibu. Yeah, sorry.
Yeah, no, Ivana, we have allowed admit you as allowed to speak. Can you try?
Hello.
Ivana? Hi.
Hello, can you hear?
Hi.
Assalamualaikum, Prof.
Waalaikumsalam.
Okay, but I'm not so sure how to share my proposal. Actually,
okay.
I cannot share it. There's no button to share.
Tak ada button to share screen ya? Are you on the computer? Tak ada.
I'm on the computer, but there's only chat, raise hand, and Q&A.
Okay. Tak apa. Maybe you can just tell us what it is so that we can. Okay.
All right. So it's still an ongoing process of the proposal, Prof. So actually, it's a cross-sectional study that we would like to do. I'm Ivana from psychiatry department lah. So it's a cross-sectional
Ivana, sorry to interrupt. You are promoted to panelist. You may share for clarity. Can you click the share button now?
Okay.
That's good. Yeah.
We have also Muhammad Ehsan Jamaluddin who put out the okay. Aftermath of patient suicide, how far to impart to psychiatrists? How far is the impact to psychiatrists in Malaysia? Oh, okay. Okay, so you want to look at the impact of a patient suicide to the psychiatrist, yeah? To the attending psychiatrist, kan? And Iwana? Iwana?
Ivana, you are muted.
Oh,
Yeah.
all right. Okay. Now I can. Sorry, Prof. Okay. Actually, after listening to Prof talk, I think a lot of things we need to improve lah here, Prof. So actually, memang it's a cross-sectional study that we want to do among the attending psychiatrists in Malaysia, the whole Malaysia, including private, public, and even in university psychiatrists. What is the impact after their patient under their care?
Yeah. All right. Okay. So, yeah.
So actually, we actually did the background of research, which include all the introduction with the purpose, our research objective. I think so included in the prop is about 2 pages, if I'm not mistaken.
Right. Okay.
Yeah, so in the background, I was talking about how there's increasing rate of suicide, and in overseas studies, there's a lot of how they found the effect of suicide to the psychiatrists. Yeah, the psychiatrists. Yeah, so the reason actually why we want to do this study, because the grieving part for psychiatrists is very culturally related, and there are no support system at all for psychiatrists in Malaysia currently. So we hope this study to become like the base for the further support system that we can create according from what we have from the study later on.
Right.
That is the aim of the study lah. So actually, I for us, we just did the objective and hypothesis. We don't really have the research questions. I think we need to improve on that. So
research problem?
Research problem pun tak ada.
I think research problem tu ada at the end of your background tu I nampak.
Oh, okay. Is it
ada a little bit macam what you have explained to me just now. Okay. They kata the impact of the patient suicide on the attending psychiatrist is not well understood, particularly with respect to cultural differences. Differences, and currently there are no support system, and not not much is really known about the impact of this. That is a research problem.
Okay.
What you explained to me just now is your research problem.
All right.
So now that is your research problem. So then you can go down and cut the research questions. What research questions to will list down what you hoping to find lah. So macam the first thing you kata, if you go up, go down.
Go down.
Okay, so you go down to you kata ni macam you write. I'm looking at your specific objectives. So you want to see what are the prevalence of psychiatrists experiencing patient suicide. Prevalence of psychiatrists experiencing. Oh, I mean you want some basic data, yeah. So so actually patients punya suicide rate lah actually. Number one.
This is the how many psychiatrists. This is not the suicide rate of patient. The psychiatrists themselves.
To determine the prevalence of psychiatrists experiencing patient suicide. So how many psychiatrists have got patients who actually committed suicide? Is it?
Yes.
So that will be the question, number one. Okay. So the number of psychiatrists with experiencing patient suicide, number one, and then to determine. And then what the question is actually the prevalence of grief. Yeah, prevalence of grief. So prevalence. After losing a patient.
Yes,
so maybe not just prevalence, but you also actually you want to look prevalence as well as extent of the grief. So extent, so that how extensive is the grief, or how much grief. Because macam prevalence ni rasa macam tak berapa informative sangat. Okay. So actually you want to do prevalence atau incidence?
Prevalence, sebab incident is a new case kan Prof, within a specific time.
Yes. So we actually you tengok historical. Okay.
Yeah, so we want to see the past experiences.
So kalau macam incident dia ada year lah, what year?
Dia ada year. Okay. Time frame.
So determine the factors associated with grief after losing a patient. So that means you want to say factors not associated, they are influencing the extent of grief or something like that. Factors influencing the extent of grief. For instance, how long the psychiatrist has been treating the patient, macam tu kan? Macam tu. So not bad means the ni lah. So those are your research questions.
Okay.
So your research questions tu will be translated, answered by your specific objectives lah.
Okay.
So kalau macam your hypothesis here, your hypothesis here is not macam 3, macam tu, it is one single one. Actually, you kata what you say now, your hypothesis you are testing is that psychiatrists who has experienced patients committing suicide, experience, macam mana nak kata, psychiatrists with patients committing, attending psychiatrists with patients committing suicide, apa tu? What is the extent of their grief that you wanting to test? That means they are actually suffering as well. So macam mana you nak put that into one single general objective? So because now you tak tahu how much is the psychiatrist ni kan? Oh, okay, you kata how much are they suffering, if they are suffering at all lah kan? So you kata the impact. Maybe you kata impact kan? Impact of patient suicide on psychiatrists is apa ni? Affecting something that you can ukur. Is affecting the psychiatrist punya well-being ke, or mental health ke, or emotional state ke, macam tu. So those are the things yang you nak test, you can formulate as hypothesis and then you ukur, to that you boleh ada measurable lah, you can measure. Okay.
So dia bukan macam is answering to the specific macam tadi yang
objectives.
So dia macam in one sentence je, Prof.
One sentence tapi general overriding. Because macam your title lah, macam your title, the hypothesis is macam your title, one big overriding one.
Okay.
So but then bila you nak address tu, it is actually individual lah. Those are the factors yang you ukur to address. Okay. Thank you.
Okay.
So roughly that is okay. Boleh. That is roughly what I very brave of you. Thank you so much. Very brave of you to come forward.
All right. Thank you for sharing. We have 2 more participants. Muhammad Ihsan, would you like to ask a question?
Muhammad Ihsan, yeah.
Yes. Thank you. Assalamualaikum, Prof.
Waalaikumsalam.
Okay, I'm Ihsan from ophthalmology. I'm doing a cross-sectional study. I'm writing my proposal. This regarding we are taking picture of children eyes now.
Okay, children. Okay.
Okay, I'm taking picture of the children eyes and correlate it to the problem that they are having.
Okay.
The thing is, what are the problems and the things I need to, let's say, take note in dealing with children as my subject?
Right, yeah. So there are the two things lah, I think, in terms of when you're dealing with you are trying to propose one thing. The first one is about ethical punya issues lah, kan? Because you're dealing with minors, kan? With minors, so then you have to get ethical approval in terms of what you're trying to do, because children are macam they are vulnerable, kan? That's number one. Number 2, I think you know that kan. Number 2, actually when you kata problems, so it's actually problems in terms of when you conduct the experiment, yeah. When you are conducting the research, yeah.
Yes.
Okay. So then the problems will be sort of, I think, in terms of getting consent from parents lah. It's just taking photographs.
And examination of the eye lah.
I think it is okay. Tak ada sangat ni. As long as you get ethical approval, I think it will be okay. Whatever that you're proposing, usually you have to write in the proposal and then you have to submit to ethics for approval. And if ethics ada recommendations that you need to do, then that will be you have to follow lah, you have to abide by the recommendations yang dapat from ethics approval. So I'm not quite sure in terms of the details of what you hope to do, but I think it has to be written down very clearly in your proposal and then submitted to ethics to get. And then apa-apa tu, so ethics tu will itulah, again dia orang bagi recommendations and suggestions and things like that.
Okay. Alright, thank you so much.
Okay, thank you, Ihsan, Dr. Ihsan.
Hi, we have very
one more.
2 more, Prof. In question, yeah. This is from Priya Tarishini. Okay, so she has a question on how to form the title what are the information needed to be part of the title?
Oh, okay. Title is actually the core of your study too. Is the information that you require to be put in the title. Is the core. So if you can, some examples. So whatever the title to must reflect accurately the research that you are doing. So that is the Nila. So it's straightforward and it's straight to the main theme. Yeah, the main thing, the main theme of your research. That should be in the title.
So yeah, so we have. I hope that answers the question. Yeah, we have one more from Sri Kashmiri.
Okay. Thank you.
So,
okay, thank you.
She would like to. He would like to get feedback on the proposal slide because he has some. He start with some of the. I think my blog. Prof, do you have time to check of his proposal slide?
Oh yeah. Okay. Ada masa ke? As long as you after this is what a tea break ke ataupun
we have 20-minute breaks.
Yeah. Okay. So if you are 20 minutes, then we can go kan? As long as they're okay.
Okay. I will promote you to panelists to share a lot.
Sri Kashini. Okay.
Yeah. Yeah, you are here already. Can you share your slide?
If you can unmute yourself.
Yes, Prof.
Okay.
Prof. I will share, Prof. Hold on, Prof.
Boleh, Sri? Ada the share button. Okay. Pain, prevalence, and recurrent children cancer, pediatric onco. Oh, from PITS, eh?
I am from the pediatrics department, actually, Prof.
Right.
I'm going to do a study on children with cancer in the oncology department in our UK.
PIT onco, okay.
Yeah. So mine is more to like pain prevalence and the management.
Right.
This is like a questionnaire, like how Mabel asked earlier. So I'm planning to do a set of questions which consists around plus minus 20 questions, and this will be validated by panels whom are experts in the pediatric oncology per se, which are my consultants, my prof and my specialist.
Okay.
So I just like you to go through my research question, whether is it valid. Like this is my. I mean,
okay.
I didn't know how to put all these into words, Prof. Actually, in.
Okay. So like, okay. So actually, your justification is something like your research problem lah. Actually, kan? You can. So you can say, okay, in local setting, yeah. So kata lack of data, yeah, mungkin berkata how much pain pain prevalence amongst children with cancer is still a little bit but you say lack of data kan, I mean and then to identify if you're addressing the pain experience, and then you want to find out pain, what type of pain or something, type of pain.
Yes, Prof.
Like a type of pain, severity of pain.
Betul, and the intensity.
Okay. So you kata what the children are experiencing in terms of pain, the extent, the severity, the intensity is actually sometimes quite difficult because children, they have problems in terms of expressing themselves and how of communicating to people. And then because you have to know in terms of management will be tied up to the level of pain that they are experiencing. So then this needs to be done lah. So so when you develop the questionnaire, you will be asking the children to do the questionnaire because
yes, Prof, we have divided them actually, like those below 9 will be helped by the parents, but those above 9 will be doing the questionnaire by themselves, but they can seek help from us. May I go to the next slide, Prof?
Right. So that would be your research problem, to justify, because children usually have problems in terms of, communicating with what they're experiencing, and so you do not know the extent, severity, intensity of their pain, and needs to be studied, especially when they are going through something as in terms of their onco treatment. Okay. So then that is your research problem lah.
Oh, okay. Understood, Prof. Okay.
So you go to your general objective. So jangan kata just obtain data on prevalence of pain. You have to more, prevalence usually the punya value tu is very small in terms of when it comes to publication nanti. Kan, you nak publish kan this paper nanti. So you kata intensity, level of pain, intensity and level of pain to determine level of pain among children with cancer in pediatrics onco. And then maybe you might want to try some management. You want to try some management to see dia punya ada intervention?
No, Prof. This one we are not.
Just nak tengok the level of pain aja, because macam tak lengkap.
We just want to take the data only because we don't have a proper data, especially in our settings. So we just.
But when you do management, macam mana you manage? So before this, how do you manage? Kalau you tak tahu they are in pain.
Okay. We do this pain scoring and those sort of thing, Prof. We use this pain score.
Right.
And the Wong-Baker scale. So from there,
mungkin you can try up to see the level of pain among children with cancer and see whether the management is sufficient to alleviate the level of pain, something like that.
Okay.
Then you are actually testing whether your current management tu is working with the patient, and then you can adjust, and then you so dapat dua-dua sekali. Okay.
This one we were planning to do something like an audit base also actually, Prof. So this will be like a pilot audit like that, like.
But you don't want to make it an audit, because kalau audit is not so much research. Kalau audit is audit. So you kata to determine whether the management of pain for the children are effective. The types of management of pain are effective. So then you then it's not. It's like an audit, but it's not really an audit. It's more than an audit.
Okay, sure, Prof. And this was my research question. Is this okay? Is this appropriate? Does it answer? No, doesn't, Prof?
So your research question too must be according to the research specific objectives. Research question too ada a few. This is like your research problem.
Research problem, this one. Okay, sure, Prof. And it was a prospective, so 2 years, inclusion criteria, exclusion. This was how I was, this was just roughly a few questions that I have come up with actually, Prof.
Right. There isn't any questions in the questionnaire yang available that is already validated overseas punya? Tak ada?
No, Prof. No.
Oh, tak ada. So you develop your own. Then of course you have to go. This one has to go through ethics committee lah to be validated, to be approved. And then you have to pre-validate first with a number, a certain lower number, and then adjust it, and then only do test. Betul.
The pre-validation, Prof, that you're telling, so I should bring up maybe 10 or 20 questionnaire and give it to some people to
yes.
be. Oh, okay.
And then you adjust accordingly from the findings too, because sometimes some too not clear, kan? So that you adjust and then only you do yang proper one.
Oh, the proper one with the panels. Okay.
With the
Alright. Okay. Sure, Prof. Okay. I think sample size and all we will have.
To calculate. You have to calculate. Right? Yes, you have to calculate.
Sure.
So, but I suggest to adjust your find out the management are working on for the patients, kan? Because you do not want just to know the level, but actually because it could be not enough because you do not know what level of pain, or type of pain. Type of pain is also not synchronized to the level of management of pain management that you're giving. It could be that also, kan?
And alleviated.
To alleviate. Yes. Okay.
Okay. All right. Thank you so much. Thank you so much.
Most welcome. It's okay.
All right. Okay. Thank you very much, Dr. Sri. I think I saw some of even the reactions of open mouth. I think they rest for tea. So thank you very much, Dr. Wan, for very informative coaching.
Thank you.
No worries for the participants. We still have 4 days of coaching with the facilitator in the afternoon session. So it will be more details. Okay. So yeah. So thank you very much again to the Dr. Wan and all the participants. We shall meet again at 10:20. Okay. Thank you very much. Okay.
Thank you, Dr. Tan. Thank you, everybody. Thank you for listening.